Thank you for opportunity. I really appreciate it to share some results of our studies and some thoughts about really very important issue we have in North Carolina. And I will talk about the hog farms and hurricanes from the aspect of human health. As we can see, North Carolina is number 2 among the top US states by inventory of hogs and pigs. So there is a lot of this business in North Carolina. And the location of this business, so you can see it here. So this is zip codes, and this is number of hogs. And dark red zip codes means up to over 700,000 hogs per each zip codes. And black dots, it means locations of hog farms in North Carolina. So we definitely see how concentrated animal feeding operations in North Carolina. This is map from the News and Observer paper, which reported the results of our study last year on hog farms and health of residential communities. And here we see the answer to the questions, which is pretty often. Okay, we have cattle, we have poultry in North Carolina, we have hogs. What is the difference in density of these industries and geographic location? So yellow, orange, yellow, it's hogs. It's really very concentrated and a lot of hog farms. Blue, cattle, yellow and purple, chicken. So we really see that among all types of these industries, hogs farms are really very large and very concentrated in one area. What's going on with livestock at hog farms? So they have wastewater, they have manure or biosolids, they have land application and some runoff in rivers and surface water, and also it could be leaching as deep as to groundwater flow. And that could affect human health, well-being, and one of good examples is antibiotic resistance. And this is the map you saw the pictures in previous presentation, hog farm site, sprayed field site, and for example, one study, not one, but that's just one cited, showed that in spray field sites, as well as in hog farm sites, there are higher level of different types of infections and antibiotic resistant bacteria, and that could be potential health risk to farmers and other residents. For addition to the studies in water, there are multiple studies in air pollution, and this is the list of pollutants in emissions from CFAOs. And you see the list is very long, and we need to understand that all what's in air one time can go also with precipitation to the ground and also could contaminate the water. In North Carolina, we have many residential communities located within 3 miles, their homes located within 3 miles from large hog farms. And this brown color, it's mean where the areas where houses, residential houses, are very closely located to the hog farms. And each resident, so that's like map of Duplin County, so each resident living here will be affected not only by one hog farms, but there are so many farms here that it could be potential impact from 1, 2, 3, and actually much more than 3 even farms simultaneously at the same time. And we need to take that into account when doing our studies. Previous studies on residential communities showed that people who are living close to hog farms have increased risk of various infections, including diarrhea, respiratory symptoms, arterial hypertension, neurologic symptoms in children, and depression and fatigue. And our recent study showed a little bit different list of what I mentioned before, what other studies showed, but some diseases are really the same. So that's design of the study. So dark red is the zip codes with the upper quartile of hog density in North Carolina, over 215 hogs per square kilometers. And you see this area. So second study group, it's hog CFAOs, like in general, zip codes with hog CFAOs in North Carolina. And we see that in this extremely high in hog farms area, 400,000 residents are living, and over 2 million people living in the areas with hog farms in North Carolina. So it's not such a very local problem. It's really widespread problem. And this is control group zip codes without hog farms in North Carolina. And what do we see? First of all, what's important, that people living in these communities, for addition to hog farms, they have difference in other characteristics. So this is the most dense hog farms area. This is communities with all hog farms, and this is without CAFAOs. And we see that demographic structure differs, so there are more African Americans and American Indians in areas around the hog farms. They have lower income, they have lower percent of a bachelor or higher degree. They have much less primary care providers in this area. And that makes important when we're looking for health outcomes to look at all these cofactors, because all of them are working simultaneously together with hog farms which are located in this area. And the results we presented last year in North Carolina Medical Journal in this paper, it was after adjustment by these 6 cofactors. And the study showed that North Carolina residents living near hog CAFAOs had higher rates of all-cause mortality, infant mortality, multimorbidity, mortality from anemia, kidney disease, tuberculosis, septicemia, hospital admissions and emergency department visits for low birth weight. And these are some examples of odds ratio. It means how high the risk of anemia, kidney disease, septicemia, tuberculosis in this area. And for all races, for white population, for African American populations, for people who are younger than 24 years old, we had in these communities located close to North Carolina high rates of mortality. And this is these communities, so that's red. Yeah, this red. And we see that compared to North Carolina average and US average, the mortality, all-cause, and from specific diseases are much higher in this area. And if we will rank these areas as separate geographic area and compare it with other US states on the rank with the highest mortality from each cause, so we see that, for example, from infections, this area could be ranked number 2 in the whole US. Kidney disease, number 3 as underlying cause. Kidney disease as all cause, number 1, and it's much higher than official number 1, West Virginia, 88, and here we have 100. So that's really a problem. Cervical cancer, uterine cancer, number 2, it could be in US if ranked separately. Asthma, number 1. Anemia, number 1. Anemia's underlying and secondary cause, number 1. So that showed us that we really have some issues of the health in populations living here. Asthma, for example, there are 2 groups of populations living in these areas. Very young children, younger than 9 years old, and people aged 45, 64 years old that are most affected compared with the people who are living far from the hog farms. Another important question that we know that North Carolina is among 3 leaders, like Minnesota and Iowa, in hog farming. What's going on with other 2 states? They also have a lot of hog farms. And we see that in North Carolina, we have much higher maximum number of hogs per county, much higher the average number of hogs per farm. So the production is number 2, but the density of location of the industry is number 1 in the US, in North Carolina. And if we will look at these 3 states and in these areas with over 215 hogs per square kilometers, in 3 states, we see that in North Carolina, for most of outcomes, all-cause mortality white, all-cause mortality African American, all-cause mortality age less 25, infant mortality. So we have much higher numbers for the areas around hog farms than for the areas around the hog farms with the same density of hogs, but in 2 other states. And other characteristics, such as household income, red is North Carolina. Household, that means areas around the hog farms. Household income lower than in 2 other states. More uninsured children and adults. Primary care physician rate much lower than in, say, Minnesota, for example. More uninsured individuals and very high healthcare costs in North Carolina compared to Minnesota and Iowa areas near the hog farms. And if we will look at the recent map of Hurricane Florence, we see that the area with hog farms this is the area with the very high precipitation level during this hurricane. And there was so much attention to this issue last fall. And for example, New York Times, they've published the paper. So this is the lagoon, and you see this fluid around. Lagoons, peat, waste are overflowing after Florence. Yes, that's as nasty as it sounds. And for example, what they stressed here, as Florence approached, farmers tried to free up more space in lagoons by spraying manure onto the fields. So they're just trying to take from one place and spray another place, but manure sprayed on fields could run off into rivers, streams, and groundwater supplies in the fields flooded. So it's like a very tricky thing what to do with this. But if you have like something like Florence, so that will be a problem. So this is BBC News. Hurricane Florence, Carolina pig waste lagoons overflow. So pig waste on the farms is run off into the lagoons and then mixed with water and anaerobic bacteria to treat the excrements. Yeah, that's understandable. But when we have hurricane, the farmers should report about some issues like flood in their area. North Carolina's Department of Environment Quality has an updating dashboard on its website recording known issues with the 3,300 lagoons in the state. The agency depends on farmers' self-reporting incidents of overflowing lagoons, and since many have left their farms to escape the flood waters, the number could be higher. The response of North Carolina Pork Council was that there are few overflowing lagoons, and the Department of Environment Quality is responding. So there is the issue of reports also here. So whom should we trust? Fox News. Hurricane Florence could leave deadly diseases, hog waste. Multiple hog farms flood. Officials are concerned about the spread of hog urine and feces that can cause significant water contamination. This is funny, I was a little bit amused. They choose this title. Yeah, so that's Sierra, that's environment, group, and we see again the field is flooded, the lagoon is flooded, and this is just brief reminder. So what I showed it was just last year, Florence, but at least in North Carolina, for example, if we will look starting 1980, how many hurricanes did we have? And that's definitely the difference between North Carolina and Iowa and Minnesota. I showed you, comparison with 2 other states. We have a lot of hurricanes. We have a lot of open lagoons compared to 2 others. These leading states, they have less hurricanes and they have closed lagoons. They do not spray it in the fields. They do not have such an issue with flood. It's difficult to answer right now question about health impact of hurricanes related to hog farms because reports of health issues for chronic diseases, for example, it's difficult to tell months or 2 months after the event. We can look, and of course we will look at emergency department visits, but as I showed you earlier, there are many other diseases, chronic diseases, which is very difficult to tell that it's only because of hurricane. But we definitely have this issue, and definitely hurricanes are regular in this area, and definitely this additional contamination and of wider regions during the hurricanes and flooding. Of course, it this is additional exposures to residential communities living in this area. And now we have fall 2019 and then fall 2020. And that's really important to know what can we do to make the next photos not so, obvious as for previous years. Thank you for your attention.